Knock knock.
Hi.
Hi, Miss Damilola Adekoya. How are you?
I'm good. You?
Good. My name is Alaki Adekoya. I'm here today to do head-to-toe assessment.
Okay.
To check your baseline and to check for any abnormalities.
Okay.
What would you like to be called?
I'd like to be called Dami.
Okay, thank you. Miss Dami, the height assessment is going to take 10 to 15 minutes.
Okay.
But I will let you know if it's more than that. Is that okay with you?
That's okay.
Because I'm going to be inspecting you, checking you from head to toe. Is head to toe a technique? Are you comfortable?
I'm comfortable.
Okay. Miss Dami, I'm getting started.
Okay.
So I'm going to put the curtain to provide privacy for my patient. I'm performing a hand hygiene.
Okay.
Are you comfortable?
Yes, I am.
Can I check your wristband?
Sure.
For your name and your date of birth?
My name is Dami Adekoya and I was born 01/04/94.
The wristband corresponds with her name. Do you know the today's date?
Today's date is 04 May 2021.
Do you know the president's name?
His name is Joe Biden.
Do you know the reason why you are here?
I'm here for a checkup.
Okay, thank you. The patient is alert ×3. The speech is clear. The posture is erect. So I'm going to touch your hair. Let me know if you feel any tenderness. There's no lesion. There's no tenderness. There's no masses. I'm going to check your sinuses. Do you feel any tenderness?
No.
There's no lesion, there's no tenderness, there's no parasite, there's no visual abnormalities. So I'm going to be checking for cranial nerve 5 and 7. Close your eyes and tell me where I'm touching.
Left cheek, right cheek, my chin, forehead.
Thank you. Go ahead and bite down. Crunch felt at masseter and temporal muscle. Everything looks good in cranial nerve 5. I'm going to check for cranial nerve 7. I want you to smile, frown, pop your cheek, raise your eyebrow, close your eyes, open your eyes. Everything for cranial nerve 7 is fine. Now I'm going to be looking at your eyes. Conjunctivitis is pink, moist. Sclera is white. No visual abnormalities noted. No redness, no discharge. Now I'm going to use my pen light, but my pen light is dead. So to flash on each eye twice. Pupils are equal round, reactive to light. Pupils went from 3 to 2 milliliters. Now I'm going to check for accommodation. Look at the pen light and follow it with your eyes. I would document Pella for pupils being equal, round, reactive to light, and accommodation. Now we are going to do cranial nerves 2. Can you please close your eyes with one hand and tell me if you can see my hand moving? Can you see my hand?
No.
Can you see my hand?
No.
Okay. Cranial nerves 2 is intact. Now I'm going to be testing for cranial nerves 3, 4, and 6. Can you move your eyeball without moving your head? Cranial nerves 3, 4, and 6 is intact. Now I'm going to check your nose. Can you raise your... There's no deviation, no redness, no abnormalities. Can you close your nose and sniff? Close one side and sniff. Close the other side and sniff for me. What can you smell?
Blueberries.
Okay, cranial nerve 1 is intact. Yeah. Now I'm going to be checking your ear, inside your ear, for any discharge of cerumen. There's no cerumen on this side. Checking the inside the ear, there's no cerumen. I'm going to examine your ear for lesions or abnormalities. There's no lesion, there's no abnormalities, no redness. Now I want you to close your eyes for me. Then tell me which side of the ear you hear the noise.
Right. Left.
Cranial nerve 8 is intact. Now I'm going to check your mouth. Can you let me your lips? The lips looks good. There's no sign of cyanosis. They are not dry. There's no crack. Can you open your mouth for me to check for your oral mucosa? Move your tongue. The oral mucosa is pink and moist. There's no abnormalities, no sore, no lesion. Dentition is good. Tongue is at midline. Can you open your mouth again for me and do ah ah ah?
Ah.
Raise your tongue up and down. Uvula elevated and at midline. Tongue is intact. There's no abnormalities. Can you tell me tight, light, and dynamite? And you swallow for me.
Light, tight, dynamite.
Swallow for me. Thank you. Cranial nerves 9, 10, and 12 is intact. Now I'm going to be checking your neck. Can you move your neck up for me? There's no visual abnormalities. Trachea is at midline. No evidence of gutter. No lumps or masses. Now I'm going to be checking for the lymph nodes. Pre-auricular, post-auricular, occipital, posterior cervical, anterior cervical, submandibular, submental, superclavicular, and testicular. Do you feel any tenderness?
No.
Now I'll be checking the thorax, but for the purpose of this video, the patient would like to leave a shirt on. The thorax is symmetrical, skin tone is even, AP is 2:1, no visual abnormalities noted. I'm going to be checking for the respiration as well. I will not let the patient know what I'm doing because this may alter the breathing. So patient have 18 breaths per minute on labored breathing, and depth is regular, no abnormalities, accessory muscle use is not present, no cough. While I'm here, I'm going to check for the spine. I'm going to ask the patient to lean forward for me and check for the spine. There's no abnormalities with the spine, and while at the same time I'm going to check for the thoracic expansion. Can you please take a deep breath for me? In, out. Another one. Thank you. Thoracic expansion is full and equal bilaterally. Now I'm going to palpate to check for masses or notch. Starting from the knee. 1, 2, 3, 4, 5, 6, 7, Then I'm going to do the same thing at the back. I'm going to check for palpate at the back to check for masses or not. Can you fold your hands for me to check? I'm going to percussive right now. I'm going to tell my patient to cross her arm for me while I check for any underlying tissue. Can you free your body? I'm going to percussive. Now I'm going to listen to the long sound, starting from the apex. 1, 2, 3, 4. Listen for one breath at each location. 5, 6, 7, 8. Then 2 at the side. 1, 2, 1, 2. Then I'm going to listen to the long sound at the back of the patient. And the apex. 1, 2, 3, 4, 5, 6, 7, and one at the other side. 8. There's no abnormalities. The long sound field is clear. Now I'm going to listen to the carotid pulse on each side. 2+, symmetrically, no abnormalities. Now I'm going to be checking for the heart sound. Right sternal border, second intercostal space aortic valve. Left sternal border, second intercostal space pulmonary valve. Third intercostal space, left sternal border, herpes point. Fourth intercostal space, left sternal border, tricuspid valve. Fifth intercostal space, microvascular line mitral valve, point of maximum impulse. No murmurs heard, no abnormality sound, everything sounds good. Now I'm going to check the abdomen. I'm going to inspect the abdomen. The abdomen is symmetric, no unusual abnormalities, skin tone is even, no distension present. Now I'm going to ossiculate first, not to induce any bowel sound. So I will start from right lower quadrant, to right upper quadrant, left upper quadrant to left lower quadrant. Now I'm going to listen to the aorta for any buries. No abnormalities, bowel sound are present. So now I'm going to percussate the 4 quadrants. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Now I'm going to palpate right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. When was your last bowel movement?
This morning.
How do you, is there any problem, or when you have your bowel movement, was it everything okay?
Yes.
When was your last urination?
This afternoon.
This afternoon. How was the color?
It was fine.
Is there any problem with the start of the steam?
No.
Was it any burning, pain?
No.
Any odor?
No.
When was your last menstruation?
The 1st of last month.
Okay. So everything looks good. Everything is okay. Now I'm going to be checking the extremities, visually inspect for any abnormalities. The skin will be openly shown here. No evidence of any lesion, no redness, no visual abnormalities. Now I'm going to check the leg as well. There's no edema, there's no lesion, there's no abnormalities. Everything looks okay. Now I'm going to check the symmetric. There's no lesion, there's no tenderness. Everything is fine. Now I'm going to be checking for the capillary refill. Can you please stick out your hands for me? Return in less than 2 seconds. Return in less than 2 seconds. I'm going to check your toes. Return less than 2 seconds. Return less than 2 seconds. Now I'm going to be checking the skin to go. No tending, quick return. I'm going to be checking your gait. Can you please stand up, walk forward, take a 3 steps forward and 3 steps backward. Thank you. The gait is balanced and normal. Please, can you stand up? Let me check the Robotech test. Sorry. Thank you. The Robotech test is negative, balance. Now I'm going to be checking the cranial nerves 11. Can you please shrug your shoulder up, up? Thank you. Can you move your head towards me? The second side. I'm going to check for extremity strength. Can you push your hand, pull and pull? Can you do this? I'm doing the same thing on the leg. Push and pull. Then I'm going to grab my finger. Push. The second one. Thank you. 5 plus extremity, no problem there. Now I'm going to perform the range of motion. Please, can you follow my direction? Neck. Hand. Leg. Into your leg. The other side. Now I'm going to check for the pulses. brachial pulse 2 plus, radial pulse 2 plus, posterior tibial 2 plus, dorsal pedis 2 plus. This is the end of my assessment. Are you comfortable?
Yes.
Are you okay?
Mm-hmm.
So I'm going to document my findings and the doctor will be with you shortly.
Thank you.
You're welcome. Have a nice day.